Can ureteroscopy cause urinary tract infections after the procedure? Have you ever wondered if ureteroscopy can lead to urinary tract infections? Ureteroscopy is a minimally invasive procedure that helps diagnose and treat issues like ureteral stones. However, it does come with some risks, including the possibility of urinary tract infections, often referred to as UTIs, after the procedure. The main reason for this risk is that ureteroscopy involves inserting instruments through the urethra and into the urinary tract. This can introduce bacteria that might lead to infection. When the instruments are inserted, they can carry bacteria from the lower urinary tract or even from the external environment into the upper urinary tract. This is a primary concern for infection. Another factor to consider is the temporary increase in pressure within the urinary tract during the procedure. This increased pressure can affect kidney function and may allow bacteria or infected fluid to enter the bloodstream, raising the risk of infection. Patients who already have urinary infections or bacteria present in their urine without symptoms are at a higher risk of developing symptomatic UTIs after ureteroscopy. To identify and manage this risk, healthcare providers often use preoperative urine cultures. Advancements in technology, such as the use of disposable ureteroscopes and retrieval baskets, have been made to minimize the risk of infections. These devices help reduce contamination and improve sterilization. To further reduce the chance of infection, prophylactic antibiotics are often given before and sometimes after the procedure. Additionally, using careful sterile techniques and minimizing the time of the operation can help lower infection risks. It is also important to note that preventing UTIs after ureteroscopy is crucial for bladder health. Infections can cause inflammation and irritation, complicating any existing bladder conditions or delaying necessary treatments. Infections might also mimic or mask symptoms related to bladder cancer, making accurate diagnosis more difficult. In summary, while ureteroscopy is generally a safe and effective procedure, there is a recognized risk of urinary tract infections afterward. Proper assessment before the procedure, strict sterile techniques, the use of antibiotics, and close monitoring afterward are all essential to minimize this risk. Always consult your healthcare provider for personalized advice and report any signs of infection following the procedure.